My name is Marina. I'm going to be a nurse today. What is your name?
Valentino Rosales.
Hi, Valentino. It's very nice to meet you. What I'm going to do today is I'm going to do what's called head-to-toe physical examination, if that's okay with you.
It's fine.
Okay, great. First, I'm going to close the door to ensure privacy, and I'm going to wash my hands. And while I'm washing my hands, I'm going to take a look at you and look at your posture and look at your overall appearance. We're going to note the nourishment, and also we're going to note the behavior and the mental status. Do you know what day is today?
Monday, November 6th.
Okay. And do you know where are you at?
I'm at home.
Okay. And what is the date of birth?
April 21st, 1999.
Okay. And who is the president?
President Barack Obama.
Okay, great. Now what I'm going to do is I'm going to go ahead and inspect your hair, in your scalp, and your skin throughout your body. When I'm going to put some gloves on and I'm going to look at the hair. When we inspect the hair, we look at the texture and the pattern of the hair. And also we make sure that it's firmly attached to the scalp. Okay, and when we look at the scalp, we look for some patches or lesions which would be abnormal findings. Everything looks good so far. Okay, and also I'm going to go ahead and take a look at your skin. What I'm looking for is, I'm looking for some rashes. Do you have any itchiness and any rashes that you've noted lately? No? Okay. Your skin is nice and warm. It's not pale. It's not cyanotic. Let me look at your nails. Your nails are nice and pink. I'm looking at capillary refill less than 3 seconds. Okay. Your skin is warm to touch, which is good. Okay. And let me take a look at your feet and your back as well. Okay, it looks pretty good as well. Okay, now remember we took vital signs not so long ago. I just want to mention that the vital signs look pretty good. Your blood pressure on both arms, we took it. On the right arm was 122/80. On the left arm was 118/60. Your respirations are 20 and your heart rate is 86. Your temperature was 98.6. Now I've noted that your weight is 135 pounds and you are 5'4", which according to the chart that we use, that's pretty normal. So that's a good thing. We inspected the skin. Next thing we're going to do is we're going to do a neurological assessment. What that includes, Valentino, is we're going to look at your sprint and your gait when you walk and stuff like that to make sure everything is normal, okay? So what I need you to do is I want you to squeeze my fingers. Squeeze hard. Good. Push against my hand. Okay. How about with your feet? Push hard. Okay, very good. I need you to stand up, please. I need you to walk. Take a few steps for me. Okay, good. Come back. All right. What I need you to do now is do a heel to toe walk, like in a straight line. Try to do that for me. Okay, very well. Come back, please. Okay. Next thing I need you to do is put your feet together and close your eyes. Okay. That's how we test to balance. When we remove the visual field, if there is any cerebral dysfunction, that would probably would show right here. So now I need you to lift your right arm and touch your nose. Do it with the left arm. Okay, very well. You can open your eyes. Okay, go ahead and have a seat, please. So, and we have a negative rumble test, and everything looks good. So what I'm going to do is I'm going to inspect your neck. So move your head from left to right and front to back. Okay. Can you move it all the way? around? Okay, great. Very good. The shoulders look nice and symmetrical. Bend a little bit. We're going to inspect as well the spine. There is no curvature noted. Okay, the shoulders. Let me see your shoulders and your arms. Everything looks good. Okay, great. What I'm going to do is I'm going to tap on your knees. Okay. Everything looks good. Now, what we're going to do now is I'm going to inspect your eyes, your ears, and your mouth. Okay? As far as your eyes, do you wear eyeglasses or contacts?
No.
Okay. Are you colorblind?
No.
Okay, great. Now, at this point, we usually have a flashlight. Mine is not working right now, so I'm going to ask you to follow my pin to make sure that your eyes are moving okay? Just go ahead. Okay, the ocular movement is great. We also, when you inspect the eyes, we're looking for a discharge and symmetry of the eyes. Everything looks pretty good. When we inspect the nose, we look at symmetry and any lesions. There's nothing like that. How's it breathing through your nose? When you take a breath through your nose, do you have any pressure or any problems?
No.
Okay, good. Also, when we look at the nose, I'm going to go ahead and percuss the sinuses. Do you feel any pain?
No.
Okay, great. So that looks good. Any discharge from your nose? Okay,
No.
good. When we inspect the ears, we look at the external ear for any discharge. Again, we're looking for symmetry. Everything looks good. We also use the whisper test. What I'm going to do, Valentino, I'm going to walk away from you and say something, and I want you to repeat it. 1, 2, 3. Did you hear what I said?
Yes.
What was it?
1, 2, 3.
Okay, great. So the hearing is intact. I also want to make sure that your mouth is fine. Can you open your mouth and stick your tongue out? Say ah. Okay, great. Well, I don't see any erythema, and the tongue looks nice and moist. The mouth as well. No protrusion. Midline is good. Let me look at your teeth, please. Okay, teeth look good. Okay, smile for me, big. Okay, great. Put some air in your cheeks. Okay, good. Well, so far, I don't see any abnormalities. All the cranial nerves looked intact. What I'm going to do next is I'm going to go ahead and listen with the bell of the stethoscope for. First, I'm going to inspect for jugular vein distension. I don't see any, and I'm going to listen to your carotid arteries for bruits. All right. I don't see anything. I don't hear anything abnormal. Okay, so neurologically, everything looks good so far. What I'm going to do right now is I'm going to move ahead and do a cardiac assessment. So we're going to listen to your heart to make sure that everything's okay. And before you will listen to your heart, the way the cardiac assessment is done is we're going to take the blood pressure on both arms to make sure it's good. Since we already did take your blood pressure, we're going to go ahead and listen to what's called the apical pulse for a full minute. And I'm going to go ahead and do that right now. Sounds great. It's good S1, S2 sound. And I'm going to take your radial pulse for a full minute, and I'm going to compare it with the apical pulse to make sure that there is no apical radial deficit. I'll check the other radial pulse as well. Okay. The next thing what I'm gonna do is I'm gonna ask you to make a fist, and I'm gonna apply pressure. This is what it's called, the modified Allen's test. And I'm gonna do the same thing over here. Make a fist. Okay, the circulation looks great. Let me check your feet for edema or swelling. I don't see any. Gonna check your pedal pulses. Nice and strong, 2+. Distal pulses, nice and strong, 2+. Wonderful. What also I would like to do is I would like to go ahead and listen to 5 different spots on your chest to make sure that the heart is working properly. So I'm gonna start. Okay, I'm gonna start with the aortic. Pulmonic. Second pulmonic. Tricuspid. And the mitral. Looks very nice. Okay. I'm going to palpate the pericardium and the PMI. Okay, great, Valentino. Now, the next assessment that we're going to perform is going to be the respiratory assessment. Do you have any difficulty breathing? No? Okay. What we'll look in the respiratory assessment, I'm going to listen to your lungs to make sure I don't hear any adventitious sounds like a bronchi or wheezes or pleural rub, etc. I need you to take deep breaths in and out. Inhale through your nose and exhale through your mouth. Deep breath. 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 Okay, great. Your lungs sound very good. We also sometimes, Valentino, what happens is air can escape from the lungs and trap under your skin. So what we like to do is I would like to check for crepitus and fremitus. And that looks pretty good. Part also, I forgot to mention that part of the neurological assessment is when we touch your face to make sure that you feel the touch. I'm going to just briefly touch your cheeks and your forehead and tell me now if you feel it, okay, when you feel it.
No, no, no.
Okay, great, wonderful. Okay, so we checked your respiratory function, everything looks good. What we're going to do now, we're going to check your abdomen. And we're going to look for abnormalities in the abdomen, okay? I need you to lay down, okay? First, when we do the abdominal assessment, what we usually do is, let me just go ahead and expose the abdomen. We look the overall appearance of the abdomen. We're looking for lesions or some obvious hernias or masses. Can you stand up a little bit? There you go. There's no protrusion or hernia noted. What I'm going to do is I'm going to listen to the belly for bowel sounds first, okay? And the way we do that is we listen in all 4 quadrants for 1 minute each to make sure we have positive bowel sounds. Might be a little cold. Very good, very good. The umbilicus looks good. What I'm going to do is, with the bill of the stethoscope, as well, I'm going to listen to the aorta, the renal, the iliac arteries, and the femoral arteries, and what I'm checking is I'm checking for bruits, any abnormal sounds. And let's see if we can listen to that one. I'm sorry. Okay, great. Another thing that we'd like to do, Valentino, is percuss the abdomen. Percussion is done with, I'm gonna just percuss over my 2 fingers. And we also do light and deep palpation. So what I'm gonna do is I'm gonna try to take a deep breath and exhale. Go ahead. We palpate the liver, the spleen, looking for masses or anything abnormal. First light and then deep palpation. Okay, great. Everything looks good so far. And I would like to talk a little bit about a self-breast examination. There are many different ways to do a self-examination. One of the ways is to pick a one day of the month and to do it on the same date every month to examine your breast. It's good to stay in front of the mirror and first look at your breasts, both breasts, and make sure that you don't see any. What you want to look for is a swelling or redness, and then it's good to start the palpation from the upper right quadrant of the breast in a circular motion with the light to deep palpation to palpate the whole breast and under the arms, and then the other one, and that's how we are looking for lumps. And for women that are not breastfeeding, it's good to slightly squeeze their nipples to see if there's any discharge. That's also a good way of breast examination. Thank you very much.